I'm Hannah.
I'm Hope.
I'm Maddie.
I'm Cassie.
I'm Kylie.
And we're Couch to Community.
Good evening. Kylie here to introduce Couch to Community. We will be highlighting key aspects of their clinic, including its mission, vision, and values. Couch to Community's mission is dedicated to providing compassionate, personalized physical therapy in the comfort of patients' homes, empowering individuals to regain independence, improve mobility, and enhance their quality of life. The clinic strives to transform the way physical therapy is experienced by becoming a nationally recognized provider of compassionate, in-home care that helps individuals across communities throughout all stages of recovery and aging. As an at-home physical therapy clinic, Couch to Community travels to each individual, tailoring care to their unique goals while maintaining an element of fun in the process. And that is how the program Power Punch originated. More on that at 11. For now, let's switch over to diving into the people and organizational structure of Couch to Community. Coming at you live to talk about the organizational structure at Couch to Community. Up at the top here, we have a rehab director with a working manager underneath. The manager sees a 50% caseload to help balance with the upper management responsibilities, such as performance reviews and productivity measures. More on that at 11, covered by Cassie. Underneath the manager, we have 3 supervisors for the disciplines of care that Couch to Community provides, including occupational therapy, physical therapy, and speech therapy. OT and PT share an admin, and speech has their own admin, who are responsible for the billing, marketing, insurance, and scheduling at the clinic. And of course, each discipline of care has a fine team of therapists that are changing lives of the patients in their homes. Speaking of the fine team of therapists, let's highlight how Couch to Community combines recognition and support to strengthen its team and patient care. Clinicians who excel can earn extra continuing education funding and additional vacation time, rewards that reflect the clinic's commitment to lifelong learning, balance, and overall well-being. Couch to Community also encourages their team to stay involved with the APTA, which is physical therapy's governing body. The idea is simple. When therapists are well-rested and continually growing, they deliver the highest quality care. For those who are underperforming, leaders begin with a clear discussion of expectations, then create a personalized improvement plan with mentorship, regular check-ins, and progress reviews. By blending accountability with empathy, the clinic builds a culture where every clinician feels supported to grow, and every patient benefits from the best possible care. Now, let's switch over to Hope to talk about the unique boxing program within Couch to Community.
Good evening. In this program innovation segment, we're highlighting a breakthrough that's packing both power and purpose. It's called Power Punch, and it's bringing a fun and unique boxing experience right into patients' homes. Using boxing gloves and adaptive equipment, sometimes just as simple as couch cushions, it's accessible to just about anyone, anywhere. Designed especially for individuals with Parkinson's, Power Punch promotes inclusivity by offering the same therapeutic benefits found in community boxing programs, but all from the comfort of home. Power Punch helps participants stay active, included, and supported, one punch at a time. For many, it's more than exercise. It's empowerment in every swing. One of the greatest things about home health is the ability to provide care right from the comfort of home. It offers flexibility for caregivers and healthcare professionals while allowing patients to heal and receive support in a familiar, comfortable environment. The same idea, bringing wellness and strength into your own space, is what inspired Power Punch, an innovative at-home boxing program designed to help you stay active, strong, and motivated without ever needing to step into a gym. The founders say it best with their catchy slogan, Power Punch, knock out pain and boost mobility, all from the comfort of your home. Let's take it to Hannah, where she will talk about the growth potential of this home health company.
Let's take a closer look at a market analysis to assess the growth potential of our home health physical therapy clinic, Couch to Community. As America's population ages, the need for physical therapy continues to climb. Outpatient home rehab is already a $53 billion industry, and experts predict it will grow to nearly $73 billion by 2034. According to the APTA, the demand for therapy services is expected to rise by 15% over the next decade, driven by longer lifespans, an increase in chronic health conditions, and a greater number of post-surgical recoveries. But while the need for care is growing, access isn't always easy, especially for Couch to Community's target demographics. Many older adults are homebound or have limited mobility due to injury, illness, or transportation challenges. Caregivers, too, are often stretched thin and need extra support to help loved ones stay healthy and active. That's where Couch to Community steps in, by meeting an unmet demand by literally bringing therapy right to the patient's door. The program focuses on helping older adults move safely and effectively, improve balance and prevent falls, and rebuild confidence, all in their own real-life environments. Instead of navigating busy clinics, patients practice skills like walking, transferring, functional mobility, and activities of daily living in the spaces where they actually do live. This approach has proven benefits: greater comfort, stronger follow-through, and fewer missed appointments. Patients are more relaxed, caregivers get peace of mind, and therapists can tailor each session to fit the patient's home setup and personal goals. The community need for this kind of service is clear. With more people living longer and managing chronic conditions, programs like Couch to Community are filling a vital gap in long-term care. Whether it's fall prevention, post-surgical rehab, or improving daily mobility, the goal is simple: to help people move from the couch back to community life. And the potential doesn't stop there. With an aging population and rising demand for in-home rehab, Couch to Community is well positioned for strong growth in the years ahead. Experts say the combination of convenience, comfort, and clinically effective care could make home-based rehab one of the fastest growing sectors in the healthcare market. It's healthcare that comes home, meeting people where they are and helping them take the next step forward.
Thanks, Hannah. We will now begin our Business Spotlight segment. A growing physical therapy venture is gaining attention for its innovative home-based care model and its specialized Power Punch program. The company's initial investment remains relatively modest, funded primarily by its founders and potential investors. The funds are allocated toward essential startup costs such as business documentation, computers, and technology necessary to launch their operations. The company's capital equipment, including therapy tools and laptops, totals approximately $19,500. During its early years, the business will operate exclusively through home visits as its home health care. Over time, management plans to reinvest revenue to establish a central facility that will serve as both a clinic and administrative hub, supporting long-term growth and operational stability. Annual operating expenses are projected to include roughly $19,000 for technology, covering scheduling systems and data management software. The largest portion of the company's budget is dedicated to their employee salaries, with first-year clinic expenses estimated at around $600,000. Additional indirect costs such as internet, fuel, and therapy supplies round out the recurring expenditures and will vary year to year. Financial projections indicate a strong start, with $3.36 million in revenue expected in the first year, rising to $3.79 million by year 5 and surpassing $4.39 million by year 10. A central feature of the financial plan is the Power Punch program. This niche therapeutic service designed for patients seeking advanced, high-intensity rehabilitation. Each Power Punch episode of care, which is estimated to be roughly 5 to 7 sessions, is expected to generate approximately $5,000 per episode of care, providing a valuable revenue stream that distinguishes this company from traditional therapy providers. Industry experts suggest that this specialized offering could not only enhance revenue, but also strengthen the company's brand identity within the competitive rehabilitation market. Steady growth projections reflect an expanding client base and increasing service capacity. With disciplined financial planning, controlled expenses, and a commitment to staff-driven care, the physical therapy venture is well positioned for sustainable, long-term success. Let's take it over to Cassidy.
Thanks for breaking down the financial side of things. Now I'm here to report to you on how Couch to Community measures success through quality and data. Couch to Community uses quality improvement methods to track key metrics such as patient visits, length of care, cancellation rates, billing, productivity, and patient reviews. The company's goal is to not only meet financial benchmarks, but also to maintain excellent patient outcomes and clinical satisfaction. The clinic follows a patient-driven billing model that classifies patients into specific payment groups based on their goals and their needs. The classification is based on data from the OASIS assessment, which includes things like past medical history, functional status, and psychosocial status. The therapists at Couch to Community typically see about 5 to 6 patients a day, treating about for 45 minutes, leaving 15 minutes of documentation time. Couch to Community is the point system to keep track of how many daily treatments, re-evals, and evals therapists are performing each week. Therapists are responsible for logging those points each week and reporting them to admin, which compiles them all onto an Excel sheet and tracks visits over time. The company also tracks cancellation rates, pays attention to Google reviews, and patient satisfaction surveys. Every 6 months, all of this data comes together for a formal one-on-one performance review between the clinician and the supervisor. These meetings highlight their strengths, their weaknesses, and areas for improvement. Some key areas that performance reviews look at are clinical competence, documentation, patient-centered care and satisfaction, time management and productivity, professionalism and communication, growth and development. Overall, the purpose to keep track of all these metrics is to ensure that Couch to Community is delivering quality care and is creating an environment where clinicians can thrive. That concludes the report on quality and data. Now here are some videos highlighting what Couch to Community has to offer.
I'm choosing Couch to Community, and you should too.